How to break into the AI healthcare industry in 2026, even without a medical degree. Let's start with a stat that should get your attention. Jobs requiring specific AI skills are growing 69% faster than the overall job market, not 10% faster, not 20% faster, 69% faster. While the average job sector is growing at about 9%, AI-adjacent roles are growing at more than 7 times that rate. And here is the part that surprises people who haven't been paying attention. 66% of hiring managers say they would not hire someone without AI skills, but 71% said they would prefer a less experienced candidate who has AI skills over a more experienced candidate who doesn't. That is a remarkable reversal of how hiring has always worked. Experience has almost always trumped everything else. If you showed up with 5 years of experience and solid references, a less experienced competitor rarely beat you. AI skills are the rare exception to that rule right now. Employers in growth industries are actively prioritizing AI-capable candidates over more experienced ones, because the industry is moving faster than experienced people can keep up with if they haven't been learning. Healthcare is one of those growth industries, and it is in many ways the most compelling one to target. Here is why. Healthcare has several qualities that make it an exceptional place to build an AI career right now. First, it is an enormous industry. Healthcare spending in the United States alone is nearly $4 trillion a year. Second, it is in the early stages of AI adoption, which means the opportunity window is wide and the competition for AI-skilled roles is still relatively limited. Third, it is a sector with genuine barriers to entry for pure tech talent. Healthcare has regulatory complexity, clinical workflow requirements, and data privacy considerations that most technology people don't understand. That creates a premium for people who can bridge the two worlds. Fourth, AI in healthcare is not replacing all the jobs. In many cases, it is creating new categories of jobs that didn't exist 5 years ago. Let's talk about the specific roles that are growing fastest and what you actually need to qualify for them. The role that offers the clearest path for people without a clinical background is health informatics. Health informatics is the field that sits at the intersection of healthcare and data management. Health informatics professionals handle the data infrastructure that makes modern healthcare run. Electronic health records, data interoperability between systems, the databases that AI diagnostic tools draw on, the governance frameworks that determine how patient data can and cannot be used. As AI has become more central to healthcare operations, the health informatics function has become significantly more important and significantly more AI-focused. AI is streamlining electronic health records and improving interoperability between systems, which is creating demand for professionals who understand both the technology side and the regulatory compliance side. Graduates with health informatics backgrounds are being recruited for roles in hospitals, health systems, insurance companies, and health technology firms. A health informatics degree or certification does not require a medical degree. It typically requires some combination of coursework in healthcare systems, medical terminology, data management, statistics, and increasingly, AI and machine learning. Programs exist at the bachelor's, master's, and certificate level. Some can be completed online while working full-time. The second role worth knowing about is the medical AI product specialist. This is a person who works at the intersection of clinical practice and AI product development, typically at a health technology company that is building AI diagnostic tools, administrative AI systems, or clinical decision support software. Their job is to understand what clinicians actually need, translate that into product requirements, help with the implementation and training process when a hospital adopts the product, and serve as the bridge between the clinical world and the engineering team. This role is growing fast because health technology companies are building and selling AI products to hospitals at a pace they cannot keep up with on the clinical expertise side. A person who has some healthcare background, even a few years working in a hospital in any capacity, and who also has genuine AI literacy, is enormously valuable to these companies. You do not need to be a doctor or a nurse. Understanding how clinical workflows actually function, what doctors and nurses find frustrating, what would genuinely save them time, is the knowledge that is hard to fake and is currently in short supply at health technology companies. The third role is the AI health data analyst. This is a more technical role that requires comfort with data analysis tools, machine learning concepts, and healthcare datasets. AI health data analysts work inside health systems, pharmaceutical companies, insurance companies, and government health agencies. Their job is to analyze the data produced by AI systems, evaluating performance, identifying biases, monitoring outcomes, and producing insights that help clinical and administrative leaders make decisions. The skills required here are more technical than the previous two roles, but still accessible without a medical degree. A background in statistics, data science, or computer science combined with healthcare-specific knowledge is the combination employers are looking for. Certifications in data science or machine learning from platforms like Coursera, Udacity, or Springboard can provide the technical foundation. Healthcare knowledge can be layered on top through coursework, self-study, or entry-level healthcare roles. The fourth category worth discussing is clinical documentation and administrative AI. This is the least glamorous, but possibly the most immediately accessible entry point. AI systems that assist with clinical documentation, automatically drafting clinical notes during patient visits, coding medical records for billing, prior authorization processing, are being deployed broadly across healthcare systems right now. These systems require implementation specialists, training coordinators, workflow analysts, and quality reviewers who ensure the AI is producing accurate and compliant outputs. Many of these roles are accessible to people with modest technical backgrounds who combine AI tool literacy with healthcare administrative experience. Now let's talk about geography, because where you are matters. The AI healthcare job market is not evenly distributed across the United States. California and Massachusetts are by far the two most active markets. California because of the combination of major health systems, pharmaceutical companies, and the venture capital ecosystem that funds health technology startups. Massachusetts because of the concentration of elite research hospitals, Mass General, Brigham and Women's, Boston Children's, combined with a thriving life sciences industry in the Route 128 corridor. Other markets are growing. Texas has a significant medical center in Houston, a growing tech sector, and several AI health companies establishing operations there. The Research Triangle in North Carolina has a notable concentration of pharmaceutical manufacturing and biotech. Seattle has some AI healthcare activity connected to the broader tech ecosystem there. But if you want to maximize your options and you have flexibility on location, California and Massachusetts are where the density of opportunities is highest. If you do not have geographic flexibility, remote work is more available in AI healthcare than in clinical healthcare. Medical AI product roles, health informatics roles, and AI data analyst roles are frequently available remotely because the work itself is information-based and does not require physical presence in a clinical setting. Let's talk about education and credentials, because this is where people get confused. The honest answer is that the credential landscape in AI healthcare is still developing. There is no single universally recognized certification that signals AI healthcare competence the way a nursing license signals clinical competence. The market is still figuring out what credentials actually mean something. What does matter, based on what hiring managers are actually looking for, is demonstrated capability. This means projects you have worked on, systems you have used, analyses you have produced, an online portfolio that shows you can work with healthcare data, build and interpret machine learning models, and understand clinical context is more valuable than a certificate from a program that doesn't require you to actually do anything. That said, certain formal credentials do carry weight. A master's degree in health informatics from a program at an accredited university, many of which are available online, is a meaningful credential for higher-level roles. A data science master's or a public health degree with a data focus can also open doors. At the certificate level, programs from Google, Coursera, and EDX in AI and machine learning combined with healthcare-specific coursework represent a credible entry pathway. The skills that matter most, regardless of what credential you have, are proficiency in Python or R for data analysis, familiarity with machine learning concepts and tools, understanding of electronic health record systems and healthcare data standards like HL7 and FHIR, knowledge of HIPAA and healthcare data privacy requirements, and the ability to communicate technical concepts clearly to non-technical, clinical, and administrative stakeholders. That last one is often underrated. The shortage in AI healthcare is not only of people with technical skills, it is of people who have technical skills and can explain what they mean to a hospital administrator, a physician, or a regulatory official. If you can code and communicate, you are worth more than someone who can only do one or the other. Now let's have an honest conversation about what this path actually looks like and how long it takes. If you are starting from a non-technical background and want to build a career in AI healthcare, a realistic timeline is 1 to 2 years to reach an entry-level position. That assumes you are treating your skill development seriously, dedicating consistent time every week to building technical skills, doing projects, building a portfolio, and networking within the industry. The first 6 months should focus on foundations, Python programming, basic statistics, machine learning concepts, and a foundational understanding of how healthcare systems work. There are free and low-cost resources for all of this. Khan Academy for statistics, Coursera's Python for everybody, Kaggle's machine learning courses, the AHIMA's online resources for health information basics. The second 6 months should focus on application. Use public healthcare datasets. The Centers for Medicare and Medicaid Services publish enormous amounts of data, as do the CDC and the FDA, to build projects that demonstrate what you can do. Join communities like Health Data Community and Healthcare AI professional groups on LinkedIn. Start reading trade publications like Stat News and Health Affairs to understand the industry context. The second year should focus on credentials, networking, and job searching. If a master's program makes sense for your situation financially and career-wise, begin that process. If not, pursue the certificate pathway. Build relationships with people already in the industry through LinkedIn, virtual conferences, and local healthcare technology meetups. If you are already working in healthcare in any capacity, as a nurse, a medical assistant, a hospital administrator, a clinical researcher, a health insurance analyst, your existing domain knowledge is already a significant asset. Adding AI skills on top of clinical experience is a faster and more compelling path than building clinical knowledge from scratch. And if you are already working in technology or data science but outside of healthcare, the path is also shorter. What you need is healthcare-specific knowledge, data standards, regulatory requirements, clinical workflow understanding, which can be developed through coursework and targeted reading more quickly than technical skills can be built from zero. The bottom line here is that the AI healthcare industry is at a moment in its development that only comes once. The skills are learnable, the credentials are accessible, the jobs are real and paying well, and the window before the competition catches up is still open. Not indefinitely, these windows close, but it is open right now in 2026. For people who are willing to make a deliberate investment in building toward it. The people who make that investment today are the ones who will be in senior roles in this industry in 5 years, when everyone else is just beginning to realize they should have started sooner. Subscribe if you want more practical, honest content about how to navigate the AI economy. We cover careers, opportunities, and the technologies reshaping how people build financial security, without the hype and without the vagueness. Up next, we're going deeper into what AI is actually doing inside hospitals and clinical care settings, and what it means for your experience as a patient. That video is coming right up.